Hello, we are surgical tech students from CBD College. We're studying microbiology. My name is Raquel de Galea,
My name is Jesus Betancourt.
and this is our presentation on Ebola and the surgical technologists, the risk of donning and doffing.
Risk of exposure and likelihood of infection. As of October 8, 2014, the CDC reported 401 healthcare workers caring for Ebola virus disease, EVD. Patients in the West Africa have contacted the virus, and these 232 have died. Assuming the proper use of PPE, wearing and removing appropriate attire based on recent experience in the United States, the risk of exposure to the Ebola virus is very low, and the risk of infection from caring from a patient with EVD is extremely low.
The need to be prepared. It is possible for a patient with EVD will need surgery, and it would be unethical to not be prepared to provide surgical care. It is critical that healthcare facilities be able to protect their staff as they provide high-quality care to every patient. Your facility should be prepared with specific surgical drapes, gowns, masks, respirators, and other items recommended by the CDC and ACS.
Who should be donned or doffed? Members who should be educated and trained on the donning and doffing of PPE include RN circulators, anesthesia providers, surgical residents, aides and attendings, X-ray personnel, scrub personnel, and any operating room personnel.
Enhanced PPE for Ebola. The N95 respirator mask, or the PAPR, or powered airway particulate respirator. For the N95 respirator mask, it must be fitted to each personnel. The duck style is recommended due to decreased airflow and has less movement on the face. The PAPR creates a strong barrier for droplets of EVD, and hoods with flaps need to extend to the shoulders and the mid-chest.
Surgical gowns covers ASTM F1671. Gowns must be worn to extend further than mid-calf. Non-sterile team members, a fully enclosed one-piece suit with a separate hood that covers the entire head and face and has flaps that extend to all shoulders, coveralls, and separate hoods are deferred as they reduce rise and cross-contamination during the process.
Level 4 gloves and double gloves. They need to be long, cuffed, purple nitrite gloves. You will don a surgical gown that is rated level 4 of protection. You don a second pair of sterile surgical grade gloves that must extend beyond the knitted cuff of your gown. You also don a pair of waterproof booties that extend to above mid-calf. Don the PAPR head frame and test for function. Eye protection and a full face shield must be worn along with an N95 respirator mask. You must perform hand hygiene, and you must don a pair of sterile surgical grade gloves, that's your second pair, and don the sterile surgical head covering using aseptic technique.
The advantages of this level 4 protection are sufficient level of protection will work operators, preclude splashes, emergence, and potential for unexpected inhalation or contact with hazardous levels of chemicals. Equivalent to uniforms worn by first receivers, providers caring for a patient admitted to hospital wards and floor beds should tailor PPE and anticipate level of patient interaction.
The level 4 protection disadvantages. There is an increased risk of cross-contamination while removing items of protective gear. All surgical staff members who participate in the surgical care of an EVD need to be thoroughly trained, routinely practice with the proper steps in donning and doffing of this protective gear. For sterile team members, doffing is a challenge as there are no one-piece suits that can be donned using aseptic technique. Due to the lack of proper equipment in major hospitals, level 4 enhanced PPE is on back order. Donning and doffing is a step-by-step process and is directed by a properly trained observer.
Removal of PPE is the riskiest point for the cross-contamination of the healthcare worker. Donning of PPE needs to be performed in a enter room outside of procedure room. PPE is to be removed in a slow methodical fashion to protect the safety of the healthcare workers. Doffing includes constant disinfection of gloves with removal of each item. Risk while removing protective headgear, they may be likely to wipe their brows, or brush their hair back, which means contamination.